We know we have to ensure Islanders have access to care.
The P.E.I. government promised in the 2023 election campaign to make virtual health care free for all Islanders. It hasn't followed through on that promise, and this public health care advocate says until it does, the province is violating the Canada Health Act. That's the federal law that stops Canadians from being charged for care the provinces are supposed to cover.
People are paying out of pocket. That's wrong because the Canada Health Act does not have room for a two-tier healthcare system. And it doesn't have room for people who can afford to pay. Everybody is supposed to have equal access.
Since 2020, the province has funded a free virtual care program delivered by Maple for the 35,000 Islanders without a family doctor. Everyone else, though, who has a family doc but can't get in to see them or into the province's busy walk-in clinics has to pay out of pocket or go through private insurance to access virtual care.
Or actually no billing code.
A couple years ago, the CEO of Maple told CBC that's not a violation of the Canada Health Act because at least at his company, mostly nurse practitioners see Islanders paying out of pocket. The Canada Health Act just says that medically necessary care provided by doctors has to be publicly insured. But on April 1st this year, the federal government changed the rules to include nurse practitioners and anyone providing that same care. The federal health minister said in a letter to the provinces more than a year ago that the change was all about ensuring patients are not charged for services that would otherwise be provided without charges if delivered by a physician.
Those services.
Stephen Staples with the Canadian Health Coalition says the rule change should have marked the end of private virtual care on P.E.I. and across the country, but it hasn't.
There's really no excuse to not have implemented this important policy. These services are quite clearly defined in the Canada Health Act. What we're talking about is getting prescriptions filled, getting referrals done. That is run-of-the-mill, standard, uncontroversial, primary medically necessary care.
Now, the federal government won't actually start enforcing its new rules until December 2028. At that point, if provinces are breaking them, Ottawa will start clawing back federal transfer payments to them. Though the federal government hasn't said specifically just how its new rules will apply to virtual care, in a statement, P.E.I.'s health department says it is working to meet Ottawa's requirements ahead of the 2028 deadline. Steve Bruce, CBC News, Charlottetown.